Great. How many want to maybe get SaltFacial in their practice? Great. How many of you have a suction-based device or microderm already in your practice? Great. So just so you know, if you have that, you can add this to that. So we have a salt and silk facial, basically silk peel plus salt facial, because to me, this is about additive effects. Patients want to know, can you get combination improvements? Can we do other things with what you already have? That will just boost you to the next level. Different areas of the body, depending on different sensitivities and things, you can use them in different manners. Someone was asking me yesterday, well, what if I don't have a salt facial? Can I do a silk peel before, or a dermal infusion as my exfoliation before I do a laser? And I told them you shouldn't, because the skin's hydrated now. The laser attracts the chromophore, which is water, and then instead of the skin being treated, you're treating the water. It actually can give you more complications because you can get more heating. So originally, obviously, we're doing things like that, and discovered different results from that. But yeah.
Did you want me to? I should possibly unlock myself if I'm going to be doing.
No, you're fine. Yeah, of
Okay,
course.
we'll see.
I'm going to talk with you through the treatment.
Okay, as long as it's up.
No, you're fine. I can talk loud. This is easy.
Good.
So I kind of wanted to just give a little bit, because obviously we have the main stage information. The device itself is relatively self-explanatory, having 3 functions, 1 being exfoliation, 2 infusion, restoration, and then 3 rejuvenation, which is LED light therapy. But people were asking me a lot of questions afterwards. So to me, this is kind of a standalone exfoliation treatment, because there's a lot you can do with it in preparation, and then in post-care, then obviously if you run a spa and you don't do as much of the strong resurfacing type of things that I do, you can have this as a solo treatment, or as something as an add-on to a service, or potentially, like I said before in my other lectures, the antibacterial effect of doing this before a filler, before a laser, and then LED afterwards for the healing. So there's a lot you can do. Tracy, why don't you talk about what you're doing right now a little bit? So it's hard for them to see the salt tracks because of the way in which she's laying. Is there any way?
Once I get around to let me just check something. Once I get around to the other side,
okay.
I'm wondering if.
That would do better.
We'll reposition.
Well, either you come on that side or we push the pillows up.
Yeah, I'll have Alan assist here.
Does anyone have any questions so far on what I was just talking about? Obviously, in terms of what you have already, how you can integrate something like this into the practice. Because I already had I had microderm plus 2 silk peels. I had actually 4 devices that exfoliate the skin before I even got this. And I have 2 now. So, we're doing a million things all day. The other thing too is we do a lot of body treatments. Most people think of this only in the face. You really should be packaging this neck, at least neck, chest, and hands. But sun damage occurs on ears, it occurs on arms. Obviously less sun exposed areas aren't as important, but women that show off their legs a lot, they want to treat their legs. And like I was telling people before, folliculitis on the buttock is a really big thing in groin area and beard. So, those are areas where you just add on a little bit, and the person's going to want to do it. And they're going to want to do lasers there, or they want to do other things there too. Skin tightening, Sculptra, whatever. So, this is going to do better than most microderms and infusions in terms of elbows and knees, feet, thicker skin areas like back, especially if someone has acne, will do better. And eventually, I'm sure, we'll have larger hand pieces and things like that to be able to do that. So I have a question on the strength. How are we deciding? What are we trying to do today? Just make her glow?
Mm-hmm. So the SaltFacial can be both a corrective as well as a maintenance treatment. It's fully customizable depending on how somebody chooses to have it done or what they need. So today, since we're...
Can everybody hear or no? Yeah? Okay.
Is that coming across good? So depending, and I'm going to keep working and talking simultaneously. So depending on someone's needs and desires, we can do a more aggressive treatment, and that would include setting the system up to a more aggressive level. The particle velocity can adjust from level 3 up to level 10. Level 10 being where we are working with Dr. Emer on a protocol for non-thermal skin resurfacing, where you get almost an erbium-like resurfacing effect, but it's non-chromophore dependent, so we can really target any skin type. They may have a couple of days of a mild sunburn look, but the results are tremendous for superficial dyschromia and fine lines and wrinkles and even scars, acne scars particularly.
And just so you guys know a little bit, who haven't done like laser fellowships and things like that, like I did, back in the 80s and 90s when CO2 was fully ablated, there was a lot of downtime. People were about 6 to 12 weeks of redness. One doctor discovered that, you know, if you take the char off the skin, then you can get deeper results, but the downtime was much more. So then they discovered that you can do multiple passes and de-char the skin, but it caused a lot more downtime, and unless you added an erbium on top of it, which I know sounds weird, to resurface, because then it was very superficial stimulation of heat that caused more remodeling, and actually people after CO2 healed better when you did that erbium pass, okay? And that's something very few doctors remember now, because very few laser doctors are actually laser doctors anymore. They're people who go to weekend courses. I did 2 years, actually 3 years of a fellowship in doing thousands of laser treatments every single day, every single month. And that was what we always did. Every CO2 did an erbium at the same time. And you get a much better outcome, actually. That's kind of one of my tricks that I don't show in a lot of my lasers. But long story short is this can act as that erbium at the higher setting, really getting into that 20 to 50 micron level and taking off that upper surface. And if you keep going, and get even deeper than that, almost giving you like that erbium-like effect. Now, without heat, every skin type can be treated, and giving you close to that type of result, which is people used to call weekend peel, which was, you know, you do, and a lot of people show this on Instagram now because it's marketing. They show this really quick, kind of superficial pass. Dr. Orion does it all the time with all these little circles on the skin. And that's literally just 20 microns, weekend downtime. Very minimal. It's almost nothing, but he never shows the after, because the after is very minimal. But that is for somebody who has darker skin type, someone who's Asian skin mixed ethnicity, somebody that has hyperpigmentation, PIH. That type of thing would be great to do every couple months to continually get that lifting of pigmentation and improvement in collagen. So if you take something like a laser, for example, and you do this with it, you're going to get that simulation of what we used to do back in the 80s when I was just born, to simplify and improve downtime. No one knows about it anymore because they don't do it anymore. I don't train people on that much detail. But when you look at the stuff that I do, which I'll talk about this afternoon using J-Plasma or Renuvion, that's how we're getting improvements at 2 weeks that people are getting in 4 to 6 months because they're not following their treatments with this type of protocol. And so what she's doing here is more of a refinement, you know, sort of every month type of treatment where she's getting a light exfoliant. Cheryl's gorgeous.
Mm-hmm. And she's probably got hot plans tonight, so I'm not gonna beat her up too bad. She's got a book signing later on, so everybody wants to run over there to see that. So she, you know, the treatments we're doing here today are going to be lighter in nature, and we just want to clear her skin, take that veil of any dead, dry skin off. And so to answer Dr. Emer's question, is set it at level 4, which is just a good basic overall. It's comfortable. It's not going to, you know, be uncomfortable or hurtful to anybody's skin. And we can just get through a nice treatment. Her skin's going to glow and feel polished afterwards, but she's not going to have any residual redness whatsoever.
Right, and then if you wanted to do a little bit more aggressive, you could do this or follow it with the peel or follow it with the laser.
Right.
And then do the LED. We're going to do something unique. This is done in my practice today, which I'll show you in a second. I'm showing you a combination treatment. Are we doing that on Cheryl or by?
You
both?
Yeah, I think you're the
wow.
You make the call.
A lot of donation here.
I had to pull some strings for that.
Pull some strings. We're going to be following her treatment with something called Aqua Gold or Ampule Infusion, which is basically a simple, low-level microneedling into the stratum corneum. So you don't get bleeding. This doesn't go deep. This is just for the superficial part of the skin to push in whatever you put in the ampule. Now, they advertise you doing things like fillers, hyaluronic acid, vitamins. We tend to add other things in there, such as mesotherapy compounds, as well as skin tightening compounds, as well as Botox for redness and to decrease oil and sweating on the skin, overall shrinking pores. So what are we doing today on the actual?
We have Xeomin, we have Bioflash, Matrix.
Okay, so we're doing a little bit of a very thick hyaluronic acid for skin plumping, but in more mature skin, that was where we would put that. Bioflash, which is an ingredient of 108 vitamins to tone the skin and make it look more radiant. And then Xeomin, which we're going to use as our neuromodulator superficially. So why do we want to do that now? Because we just exfoliated those superficial microns. We're now a little bit deeper into the skin. So she's brushing off that salt. And remember, we said in step 2, which is the ultrasonic cavitation, we can push topical products deeper into the skin after the cells have been warmed up. It's like, taking, warm up on a treadmill and then you start your run. We just, getting her skin warmed up, we're going to cavitate in a second. She's going to put some nutrient in. The cells are going to be more likely to want to uptake the topical that we're going to put on. Okay?
So the second step, we are taking advantage of that nice receptive surface. We're just going to use a little bit of this mandelic acid.
So she's doing a little mandelic acid. I personally like a combination of acid, salicylic, lactic, and mandelic would be what I would apply right now to at least get a superficial peel. If somebody was okay being red for a few days, if they only wanted to be red for a few hours, then mandelic is fine, or a simple light salicylic acid.
Yeah, so just give her a nice little refreshment. And we've got some lighting gel here.
Talk to us about the ultrasound.
So cavitation ultrasound, we have it on the SaltFacial it's an aesthetic ultrasound. It's not a physical therapy ultrasound. It's specific for this procedure. It's got a very small treatment head so you can get right in and around
Show that to the
areas.
camera for a second.
Yes. There you go. So this area here is completely sealed, so you can actually immerse this if you wanted to. You can also, if you're working with PRP, you can also cover it with a sterile sleeve. And it's a process of cavitation, which you're not going to feel anything when you use this, or I should say the patient won't feel anything. There's no sensation other than just the nice, cool feel of the metal on the skin, which I think is surprising to some people because they're expecting maybe a sensation of a pulsing or a warmth. But the cool actually feels very soothing after the stimulation of the salt. It's a relaxing 8-minute massage based on some studies that were performed in the past with our system. And the cavitation process helps the skin to relax and the cells to open up so that they make space to absorb and take in the product that we apply. Some of it has to do with the Dalton weight. We have to use a product that's under 500 micron, and under 500 Dalton weight in order to be absorbed effectively through the process of passive diffusion. And that's what we're doing here, is allowing the skin to absorb. Oh, sorry, thank you. I got to talking, I forgot to press the start button.
Any questions right now? Cheryl, tell us so far the experience.
It's very cooling and soothing right now.
Soothing. What did you feel about the salt? Did you taste the salt?
No, I didn't taste it.
Sometimes a little salt whiffs into the mouth and it feels like they're on vacation. Or at a Mexican restaurant.
That's right.
That's why I think everyone should get a margarita.
That's right.
Depends on your practice in your state. You can look up their own laws. Did the salt part hurt at all?
No, not at all. It felt very much like a microdermabrasion.
Mm-hmm. What was the sensation?
I guess like a salt just running through, like a dermabrasion on your skin.
Okay.
Very light. It was not uncomfortable at all.
Okay, great. And then now with the cavitation, do you feel anything?
Just a very cool, soothing, like gel being massaged into the skin.
Great. And here you can, there's a lot of things you can do at this step. You can do this cavitation portion, get the cells receptive, and then start your other treatments. We can do radiofrequency to tighten the skin a little bit more. You can then do lasers or peels. You can do microneedling, mask, whatever you want to do can be done after the cavitation portion because the cells will now uptake much more material. So right now she's prepping the skin basically, and then long term you're going to get more collagen production and skin tightening.
Yeah, and I like to focus, it feels good all over the skin, but I do like to pay a little more attention to the areas of the skin that people typically need it most, around the eyes and around the lip area. If someone has 11s or anywhere furrowed areas, I will focus a little bit more. One thing I do like to mention, because people will say, well gosh, isn't that microdermabrasion? That's something we hear quite often. Well, somewhat often. The answer I would give is that really the similarity that the SaltFacial does have with microdermabrasion, and then it stops there, is they're both forms of a mechanical exfoliation, both using some kind of a particulate base. But the salt is different. It's water soluble. It's pure natural organic sea salt, and it's positive pressure, so that there is no suction or vacuum with this system. That is one of the unique features with this. Microdermabrasion is always using suction or vacuum, which is really hard on the skin. It can cause petechia and hyperpigmentation and problems, and usually you're limited to lighter skin types. With the SaltFacial, because of the positive pressure, there is no vacuum or suction. You can use it on skin types 1 through 6 without the risk of breaking the skin and causing any damage, as well as people with rosacea or delicate skin with tendency for broken capillaries. So it's really widely available for all skin types. The salt itself is naturally antimicrobial and antibacterial, which makes it a perfect skin prep, as Dr. Emer mentioned, for prior use for a lot of procedures like microneedling. It just clears that path for anything that you're going to do to follow, whether it's a light-based treatment, any kind of phototherapy, or a whole host of treatments like we're going to do today, the Aqua Gold procedure. And it really makes the skin, puts the skin in a naturally balanced pH state, so that it's just good dermal health. Skin's in a great space for anything to follow it.
Which is also why I like this for our acne patients, even though I don't truly believe acne is bacterial related. And I'm probably one of the only dermatologists that does not prescribe antibiotics for acne. But
Good for you.
I do a lot of Accutane though, very significant amounts. I'm the other dermatologist that prescribes at least almost 5 times a day Accutane for patients, because it's the only curative treatment. Plus, acne patients are known to be carriers of bacteria, but community-acquired bacteria, not bacteria that people report is in acne. So we're talking about MRSA and staph and strep, and those are treated by the salt. So in general, if you're going to do a laser or peel on any of those patients, this treatment is going to be preventative to any infection, which is great, which is also why I have my patients every month get this treatment done while they're on therapy.
That's a good point. And something too, another question people ask about is LEDs. Do you mind if I mention that?
No,
LEDs.
bring it
So, okay. We have on our LED, we use a 414 nanometer blue light, which is important. And the FDA is very particular about recognizing certain wavelengths and what they will put their stamp of approval, if you will, on. And there's really a very small window between 404 nanometers and 420 that is recognized for the clearance of the P bacteria that causes acne, as well as SARS and MRSA. And we're one of the only, I think, 2 companies, if I'm not mistaken, that actually has that clearance, because we're at 414 And so I did have, and I don't know, have you shown the video yet for my J plasma?
No,
If anybody's
showing it this
considering J
afternoon.
plasma, I'm happy to talk with you about it because I was one of Dr. Emer's first patients. I had a remarkable result with it. I'm happy to talk to anybody.
So I typically don't cry in my video or before ever seeing my videos, but when I saw Tracy's video, tears came to my eyes.
I love
Because
it.
the results are very dramatic.
Really
Like,
dramatic.
Unbelievably dramatic, but also the story behind it, which I'm going to lecture about at the 5
Yeah.
to 5 time period today.
Really pleased, really
But
pleased.
plasma resurfacing and plasma internal heating.
I'm a carrier of MRSA, and I've had it before in my face from a prior surgery that I had a few years ago. And right after that, during the healing process, I was fortunate to have this light, so I healed very quickly.
Very fast. She has a YouTube video 5 days
Yeah.
afterwards where where it looks like she was 3 weeks in healing.
I was completely re-epithelialized at day 5.
Which is unbelievable because you guys don't understand that plasma resurfacing is like
It's
doing a
rough.
phenol peel, basically.
So at day 3, I started getting a little funky on my upper lip where I knew something was going on.
'Cause that's right where the nose is. That's typically where people will get an infection.
So I shifted from using the
Oh,
red and
okay.
amber, which I'll show you, to using the red and blue, and it stopped it immediately.
So it goes to show you don't always need medicines to treat things. Sometimes it's actually procedural. And we talk about this, Candace, my esthetician, and I talk about this all the time. We have a young guy that came in recently, Indian skin, hyperpigmentation, terrible acne. And I wanted to start Accutane, and in general, for women, you have to wait 30 days. For men, it takes sometimes 1 or 2 weeks because of the getting in the system and everything. So I told him, you need to come every 5 days for this facial. You do the skincare products, then we're going to start the lasers. And he did every 5 days this treatment with light, and all the acne cleared. Everything cleared before the Accutane. I'm like, you're still doing it. I don't care what you say, you're still doing it. He did it.
Yeah.
Because the problem is it's hormones. A lot of it's hormonal, it's inflammation, it's blockage. That we just released everything, that's great, but he's not going to come in every 5 days for the rest of his life. It's not going to happen.
Right.
So we cleared it all, we got it all improved. Now we can laser him appropriately, which we did. So then we started the lasering process. He's on month 2, completely clear, pigmentation's gone. We'll wait him about 6 to 9 months on the Accutane. We can off of it. He'll never have acne again.
Oh, I'm doing
And he's Indian skin. Indian skin type, all reversal. Actually, we even did a lightning peel. I think we did a Cosmoline peel on him too. And he did great.
Oh, wow.
He's very happy. So that goes into overall customization of procedures for patients. It's not about a one and done medical treatment necessarily. This is kind of her ongoing therapy. And in patients that really see improvements with this, they'll come in very frequently.
Yeah. And this light is one of those that you can use for as an individual modality.
Can you use it with Levulin?
Yes.
That's what I wanted to point out.
Thank you for asking. Yes.
Does anyone use the Levulin therapy? Great, so if you have a blue light, which personally, I did all the clinical trials for Duso. When I was a fellow in 2007, yep, I did all the arms, the chest, the scalp,
Thank you, my dear.
the face studies. We did it with microderm first, we did it with Fraxel, we did it with everything you can think of. I did 4-hour incubations, overnight, 3-day incubations. You should have seen the results of that. One of my patients said, who was a Holocaust survivor, by the way, said that was worse than the Holocaust. That's what she told me. Swear to God, I'm not kidding.
Hiding in the dark for
She
3 days had to
she
be
said
really bad
to
too.
me, that was worse than the Holocaust. But the interesting
How long
thing is
was the
because
light?
it was so inflamed, she literally had no wrinkles. All the wrinkles disappeared on her face. It was like the strongest chemical peel you've ever gotten. But that was a 3-day incubation. So then we developed the research that got to you can do it as quickly as even an hour, but 4-hour incubation is probably really good. Now I don't even do the treatment anymore because if you look at the studies on it, there's a high rate of recurrence. That lasers actually do better. So if you're going to do it, you have to do it with laser. That's really the treatment. It should be Fraxel plus PDT. Otherwise, not even worth it in my opinion. You're stealing from insurance companies. But yeah, that's my opinion. But long story short is you can use this light to activate chemicals because the wavelengths are the FDA-approved specific wavelengths, and you could then have as an additional light if you wanted to do different areas. Like we used to have literally 4, we're doing like arms and legs, and we'd have like 4 lights. It was insane, it was crazy. But you could use this as an additional light, or you could treat another area while the person's lighting one area, But you can pre-treat with SaltFacial to again get that in more. And if someone had like, you do skin cancer treatment, someone had like SKs or very thick area, you can curette it till it bleeds, put the chemical on, and do this, then do the light. And then you get a really big result. It's very dramatic.
And if you are using it, if you do use levulinic acid, this is a much easier LED to get under or around because it's completely,
As I was saying, it's movable, it's not square.
yeah, if you've ever, and I speak from experience because I've had plenty of PDT
Square inside
myself.
a dome inside a square doesn't work.
Trying to get
Not the best.
yourself positioned in a U-shaped, you know, when you've got broad shoulders is not an easy thing to do.
No.
And stand there for 17 minutes or whatever, yeah.
Yeah, it's hard.
It's tough, yeah, so.
Any questions as of right now? No? So we're gonna go, so what are we doing now, Aqua Gold?
Now we're going to do the aqua gold.
So remember, cavitation ultrasound's been done, cells are receptive, we now can do, now, this is, I just quizzed the audience. Does anyone know the
Just
depth
pops up.
of the aqua gold needles? Yes, very good, 0.6 millimeters. So there's an actual second version, it's 0.2, but this is the 0.6. Because that's a perfect, and I was talking about this microneedling in my last previous thing where everybody does this like really aggressive 1 to 3 millimeter microneedling. You don't need to do that for rejuvenation. You just really don't. Maybe a little bit for scars, you can go to 1.5 or 2 in certain areas, but if you really want to over-traumatize the skin, the goal for this is somewhere between 0.5 and 0.75. That's the key for the stratum corneum, or right below it. We've obviously removed the stratum corneum already because we probably did. How much do you think you exfoliated with that? How many microns?
Maybe 20.
20? That's what I figured. So
Yeah,
20 is like a very light amount that's good to do before a chemical peel. It's good to do. It's almost like even a little bit less than what a Jesner's peel would do potentially. But now that's gone. So the very expensive products that you're now pushing into the skin go through that dead surface layer. You don't want that dead surface layer there. And I've been testing this now too for feet sweating. Because if you can exfoliate the feet and then do this, how many people do foot injections of Botox? I do a lot. And it's very painful. Like, I'm not even kidding you what my patients do. I have to put them at the end of the day when no one's there because they're screaming. So I don't want people to think it's like a torture, hospital or something. So the problem is that even with, I did nerve blocks on the feet, you can do everything. You can wrap the foot for 2 hours, you can do Zimmer cooler, you can have a rolling ice. I've done every single thing you could possibly do except paralyze the foot. And it hurts a lot. So it doesn't matter the strongest person. But if you can get this past the thick layer on the foot to the problem areas, which typically is the ball of the feet anyways and the toes, and the thick areas aren't as important, then you can get a lot of improvement in sweating. It won't last as long as the injection at the top, but it will last. And some women, they just sweat in their shoes and they hate it. They can't wear, patients can't even wear high heels because they'll slide right off of them and then break their ankle. So they get upset. So right now she's doing the 0.6 millimeter, and do you see bleeding? No, you really shouldn't. Between 0.5 and 0.75, not much. Sometimes what I'll do is you can push a little bit harder and kind of squeeze, turn, twist a little bit, like push and twist, push and twist, push and twist, rather than dab, 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 dab. You can kind of push a little bit more and twist. You can do that a little bit more in problem areas, thicker skin, stuff like that. But right now she's infusing a type of hyaluronic acid, a neurotoxin, a combination of 108 vitamins that doesn't smell the best. That's how you know it's good, right? What does it smell like?
B
Cheryl?
vitamins.
Yeah, B vitamins, exactly. It smells like a B vitamin shot because there's 108 different vitamins there. Patients go crazy over this. John, come show your face really quick. I'm going to call up John because John is one of my practice consultants. Obviously, he's very, very good looking. Everyone loves how John looks. Everyone clap for John. No, but John gets Aqua Gold regularly. He loves this treatment. Tell him about the treatment.
Well, like we talked about, a lot of those combination treatments with the facial, it's really easy. And the combo that we do, depending on what your concerns are, for me, I really don't like my pores. I know we all really get crazy with ourselves, but this area, especially with working out, gets pretty bad. It's super easy, and like you said, monthly to do it. Fantastic, and it adds, 15 minutes on. So for busy people, it's really not that big of a deal. Yeah,
What did you notice when you first started the treatments the most?
Well, the pore reduction, for
pore reduction. How many people ask for pore reduction and then get lasers and say that the pores don't reduce? Really, the only one that I've ever seen is Clear and Brilliant, and even peels, they make it look better for a short time, they always come back. So nothing's gonna cure it completely, but it does shrink them a lot, and the patients do say that they get pore reduction and a quick glow to their skin really quickly. I even do this, patients will say, you know, they work out, like he's describing, he sweats a lot in his cheeks and his forehead, the sweating really stops. You know, when you do
And the redness too, a little bit.
yeah, and that's the other thing is a combination in the readiness of the skin. So I did a study, and Steve and Diane did a study where we injected Botox into the cheeks. He did Dysport, I did Botox actually, and both showed a very significant improvement in rosacea reduction up to 6 months in one treatment. Obviously, be very careful, obviously, because if you hit certain muscles in that area, it's going to make the mouth droop, which did happen in one patient. But then we learned how to do it very superficially. Then this came out, which is very similar. The depth is actually basically the same. It's almost just a little bit more superficial.
The Neuros helps with the rosacea?
Oh, significant. Lots of research on it. Many years of studies. About 8 years of studies on it now. And so we combine that with a laser genesis or some other, you know, Aerolase, vascular laser, IPL, whatever, to decrease the redness, but then this keeps the flares under control. So if someone, you know, is exercising, they're drinking wine, and they, you know, get excited or whatever, calms it down. So that's it. But look at John's skin. If we can get you into light, go over here. Look at John's skin. I mean, obviously he does skincare and everything, but that's what your patients are going to do. Under bright light, he has no pores. You know, so that's skincare, microneedling, a little bit of these facials, and aqua gold. That's all he does. He's never done. You've never done a strong laser.
No, I haven't yet.
No,
Just Vivo.
we haven't done. You just did Venus Vivo one time. So you know, your younger patients obviously different, but you have to address the, you know, that if you have patients that just wanted rejuvenation and look good all the time, very simple solution. And the key is what combinations are going to be able to give you that. You know, and those are very simple with no downtime. You know? And how many women do you know that have very light skin like her and then are red all over their neck and chest?
Yeah.
So you got to start doing that. You got to start doing that treatment. It makes a huge difference. Till you can do very light lasers there and everything, plus aqua golds, you know. And I don't work for aqua gold actually, just so you know.
No.
They make a lot of money off of
You
it.
should.
Well, we've had the discussion. Aqua gold has made a ton of money off of my
Aqua Gold
videos.
is not even here, but they're,
Yeah, that's what I'm wondering.
yeah, no, they're not here, but I told them, I've got their card and they're in Nevada.
But
They were generating
I've
Nevada,
been,
they're here, provide a couple samples.
I've been doing this a lot anyways with mesotherapy. It's a very similar thing. The difference is even with mesotherapy, you're gonna get bleeding. So that's the only negative. But, you know, there's some mesotherapy guns from Korea that aren't legal in the United States that are that depth. That if you could get them in the United States, would do the same thing. But we basically can't. So yes,
One more time, what is in aqua gold again?
whatever you want. Put whatever you want in there. I make my own.
What's the ratio?
I know how.
That's a whole other thing. I can't give you that information. That's proprietary, because Aqua Gold doesn't pay me enough. Doesn't pay me anything. But what I'm saying is you have to figure out that combination, and the Botox numbers are based on the research that Steve and Diane and I did. And it's in the literature. It's in the medical literature.
From aqua gold?
No, from my own research in PubMed. PubMed. Written papers that have been published.
Oh, they're published.
Yes. Yes.
That was my same question, is just that are you compounding each peel specifically for that patient?
Yes, so each one, that's why patients like it, and you can also do it for that day. Because what if someone comes in really oily that day? You know, maybe you're draining your oil more. I might not want to put vitamins on them that's kind of stimulatory sometimes. And I might want to put some things that kind of calm the skin down a little bit more. Higher level of the Botox versus filler, you know, that type of thing. I also have patients that have very chubby cheeks. And there are products from different mesotherapy companies that actually tighten the skin or shrink down those areas. We call them face slimmers, but they're, you know, they're not very popular in the United States, but very popular in Korea. And I use it all the time for facial sculpting. Patients get unbelievable results. But those are types of things that you can do to really make a big difference. And then limit kind of the fillers that you're using all the time, because my opinion that what's going to happen with fillers now is fillers are going to go more towards a superficial, they're going to keep moving more superficially to fill fine lines and soften skin, because we already have enough lifting fillers and people are just aging with more wrinkles. And so you have to be able to treat a wrinkle. You can't inject Juvederm into a wrinkle. It's terrible. So, and you know, anyone that's still doing Juvederm under the eyes is just crazy. But my opinion, only it's my opinion, but a lot of the fillers now, like Volite, which will be coming out very soon, obviously Bellaterra that's on the market, and outside the United States there's many more, that are all superficial fillers. And the skin and the face looks better when you do that. You do less plumping fillers, more softening fillers. And they look, you know, they're combining that with skin tightening and resurfacing. You just look more natural, rather than, you know, aging and kind of, you know, looking strange. The other thing too about the fillers, too is patients will come into me and saying they want fillers and they need a facelift. And I tell them, look, fillers do not lift. I don't care what anyone tells you, what the most famous filler person in the world, fillers don't lift. If your cheek is down here, it's going to be down there until it's lifted. You know, and you can make a fake one, but then it's going to look weird all the time. So at some point, it needs to be lifted. If someone's not willing to lift, then you have to ask yourself, do I want to be responsible for that person walking around with a cheek here and here? And then someone asking what you did, because that's what will happen. And that's the problem I'm seeing now. The patients that come to me that are in their 50s to 70s that have tons of filler and need facelifts. They look really bad. And I tell them we're reversing it all and you're getting a facelift and fat grafting. And if you don't choose to do that, you don't come to me. Because that's not the treatment. You can do Sculptra to build collagen, and you can do other things like this to like then naturally lift. Threads even aren't going to be enough in a patient that age. So younger patients, it's fine, but you know. So with Vahe, we're going to do the strongest treatment possible, right? Full resurfacing. We're going to 11, 10 plus.
Well, oh, sorry.
No, I said you didn't hear everyone laugh. I said with Vahe, we're doing the strongest treatment possible, right? He's going to leave with pinpoint bleeding.
Yeah, I'd like to leave him in his space.
Okay, well, she wants to keep his face.
He's handsome too.
So this is a young patient that gets a little bit bad.
Yes.
Does very well
Beautiful
with this and Clear and Brilliant, actually. Basically that, and you can add in something like a microsecond YAG laser or IPL, like the Venus Versa I talked about, would do great peels lightly. You can create a package for your young patients. You know, they have acne facials, things like young teenage facials and stuff like that. You do that with some sort of laser that's enhanced, it makes you look so much better. You can do that, so we'll go a little bit stronger to 5. And you can see, look at the difference now in the salt track. It's substantially increased.
How's that like? I'll lower it. And Vahe's got good skin for this. He's
Well, Vahe's been getting SaltFacials for a long time, like a year.
Your skin does acclimate to it the first treatment. I think some of it's apprehension. You okay?
Tell me, do you feel a difference that you've done a lot of treatments treating men and women's skin?
Yes.
What do you notice?
Men are a little more delicate most times. And
Alan didn't complain that much when I did 10.
No,
When I did
Alan's
10 on
really good.
Alan, he didn't complain that much.
But Alan's also broken his nose 7 times.
Yeah, that's
7
true.
times and reset it himself, so he's.
And he doesn't box.
That's right.
He's broken his nose 7 times.
Yes.
Yeah, exactly. Oh, she wanted to do J plasma without numbing. She just wanted topical. You can't do it with that. You have to two-mess the whole face. Oh, I have a great picture of her with her whole face two-messed. Yeah, it's very cute. I didn't put that in the presentation though.
Oh my goodness, I was showing somebody that picture yesterday. That's pretty funny.
Yeah, I know.
Not a good
So, you know, yeah, it depends. I mean, I find that the men are obviously not used to doing treatment. They're not used to plucking their eyebrows, getting makeup when they're 4 to 10 or whatever, eyelashes. I mean, they're just not used to all that. It's a waxing. They're not used to it. So doing this, they think this is the worst thing in the world sometimes. It's crazy.
But I think once you've had a treatment, the next one.
Yeah, you're totally fine.
Yeah, I think, you know, your skin gets a little more acclimated.
Tahi, do you taste any salt yet?
No.
No, so she's very good. Because if you taste the salt, that means that the way you're lifting the handpiece is perfect. If you don't taste it, it's perfect. If you taste it a little bit, it means a little bit just flickers out, which is, you know, that means it's not as fully 90 degrees. It's not going to hurt the patient, but if you're going a little quicker, it might, you know, a little bit might flicker out. But a lot of patients will taste it. And they like it, actually. They think it's great.
That's actually on 3. Have you used any retinals?
I did.
Ah.
Well, see, but here's the thing, let me explain that. So I don't stop those things in my practice because I want a better result. I actually have patients do retinol twice a day, the week before they come in, and I have them do a microneedling with a retinol mask at home before they come in to do a treatment.
Like your
Because
style.
the results are better, they're much better.
Talk more about
Are you
the
using
salt
0.5?
and why the no salt so much.
You come down here, come up here, Candace, come up, yeah. Let's have Candace come up, she's our esthetician that has been working with SaltFacial for a very long way. You're not gonna get through it, be careful, there's a loop.
She's so limber too.
Oh my gosh, yeah, why doesn't she come up? She was saying, I want to talk about the salt. So the one thing that Candace, now this is different than my medical training. I did not really believe that food has any impact on acne. I really just never, except for when I saw some guys that came in on certain protein supplements and their acne would get flared like crazy. It's always casein protein. It's always milk protein. So then Candace goes, oh, I don't let anyone drink milk. You know, dairy, no. If you have acne, forget it. So then she goes in her whole everything about organic, all the different foods, and then she loves the organic salt. So let's talk about that.
So the salt is my favorite form of exfoliation because it's natural. I don't mind chemical exfoliation, but for physical resurfacing, this is my favorite. It's very gentle, so I love that. I've never had anybody bruised by this. I mean, how many of you have used maybe a microdermabrasion machine or a HydroFacial and you've had some suction marks, little hickeys? It's not a good look when you go home. So this is my favorite. I've never had a problem with it with anybody. The other component is that the salt retains water in the skin, so it really gets your skin truly hydrated at a cellular level. So for me, this is my option. I would choose this over any other device for physical exfoliation. What else?
Nothing. Is there anything special about
Yeah, no, it's true. I've been doing this for 12 years, and I've had issues with diamond tip, dermabrasion. I've always scratched people, and I've been doing it forever, and it's just one of those things. So for me, I feel more comfortable treating with this one.
And just so you know, just a little bit more about Candace. Candace worked in a very famous Hollywood spa where basically every celebrity goes. And the woman that owns the spa is a very good friend of mine. And when Candace wanted to go medical, she goes, you know, you're taking like every celebrity's main person. But I want her to be in a medical space, so I'm only going to allow her to go to you. Even though Candace obviously had the choice to go wherever she wanted, I had to get like, you know, if you have to ask the father to marry you, that's what I had to do with Candace from Olga. So long story short is, Candace went to a place where when the women walk out, TMZ is there. I mean, I hate to say it, but it's the truth. Sometimes we have to call them and tell them they're at a different place when we know they're there. We'll say like, you know, X is, oh, we just saw X go down the street to shoe shop. And then they scatter over down there and we get them on the back. Because, and then if they take a picture with bruising on the face or a peel, they then question the result of the person. Not of the result, it's not of the fact that that's a treatment, that's what it is. But we don't want to scratch people, bruise them, etc. We're under a different spotlight being where we are, unfortunately. We have to do those crazy things, which I think is absurd, but it's just unfortunate, it's what it is. It ends up going on E! News and stuff. But long story short is, this doesn't ever do that. Now obviously, if I do the treatment, like if she's just doing this for regular purposes, people walk out fine. If I do this with erbium resurfacing or CO2 or whatever, you better be hiding. Like you walk out looking terrible. Like the other day, a patient of mine flew in from Hawaii to have this with a CO2 and a bunch of other fillers and all this stuff, and literally his face is just bleeding everywhere. And he walks out, and I was like, that looks perfect. And he goes, great. And he's like bleeding, blood is like dripping down everywhere, and his face was this big. And then, you know, that was it. So let's take the Cheryl, come up, show everybody. This is Cheryl. How do you look? Tastes like salt. No, what do you think? Actually, you have to go here because there's no light.
Yeah.
Go over there so you can show. But I think your skin looks very radiant.
I didn't see it.
It looks very radiant. And so yeah, here, turn. I'm not going to tell everyone your age. I won't say it. But what do you think? I mean, for just an exfoliation treatment that's light, similar to an erbium, with the light, with plumping,
And it feels really good.
and you look really good. How does it feel?
It feels great. And it feels great.
And you've been in the industry a very long time.
Oh, one.
I'm not saying the ages. But my question, the whole point is wisdom, you have it. So what do you think of this compared to things you've tried before? Do you think it's a unique and novel treatment?
Definitely impressed. Definitely impressed. I know you were impressed. We talked about it a year ago. We talked about it 6 months ago. I think we even wrote an article about it.
Yeah, we did.
And now trying it for the first time, I'm definitely very impressed.
Great.
It was great.
Good.
And I have to come back to California so I can have one done in how long?
Yeah, we'll do it with a laser. Let's do it with an erbium.
Come visit.
Great.
Thank you.
So
Well,
yeah,
it
the
was
question
my
is though,
pleasure
with
to
you,
meet
the thing with her now that she did the aqua gold, in about 3 days to 2 weeks, she's gonna notice a significant reduction in redness and oiliness in the pores. So you have to report back.
Yes,
We'll do a
of course.
little,
Just
like
from the
selfie video.
neuromodulators, The rosacea.
Oh,
decrease
yeah.
rate Just from the neuromodulators.
Yes, 100%.
I like to do it like around the hairline and the nape of the neck.
Yeah.
It's really good, especially in the summertime. You know how people get just like oily and greasy?
Yeah.
It totally helps with that. So I like to really stamp right in
I
this
have
area
yet to
all
find a
around.
patient that, or I've yet to find how often you cannot do it. Because I have some patients, they have the money, I guess, they'll come in every single week and do the treatment. And they love it. They don't want to do anything else because they don't want people to know they have anything done. So they literally scooch in VIP entrance, go to her, get aqua gold and a light SaltFacial, and then they walk right back out. And they look good all the time. But those are the people that are like under spotlights a lot, so they sweat,
Oh.
TV, things like that. They're putting makeup on all the time, and they get clogged pores, like very significantly, acne flares, and they just don't want to have that because they're constantly in the public eye.
Or the people you treat that with IPL, for rosacea, you can only get them so far. You still
Oh
have a
yeah,
little red
and you got to. That's when you start